Okay. Oh, it looks like 4 people. Oh, here we go. Okay. All right. Some extra people joining us. So thank you. Welcome. This is my webinar for Medicare Advantage Curious. So basically, we're going to uncover the differences between what a Medicare Advantage plan is and how that compares to a Medicare supplement. So for those who don't know who I am, if you're joining the call, my name is Nicole Wall. I am with Holten Insurance. We've been around for over 25 years. And the idea of this is to, um, you know, clear up any confusion between that Medicare Advantage and Medicare Supplement plan. Oh, and then this is, sorry, there's still people coming in, so I'm trying to deal with that. And then if for those that haven't come into my home office, this is our team mascot, my dog Harley. So had to throw that in there. Okay, so what we're going to go over today is, okay, what are all those different names? So we hear, Medicare Advantage being called a handful of things, Medicare Supplement being called a handful of things. So we'll go over that. Then we're actually going to dive into the specific differences of each plan and kind of go over like the pros and the cons and really hash that out. And then next, we're going to go over any changes, like what if you want to make a change? What if you have a Medicare supplement now and you want to move over to a Medicare Advantage? What does that look like? Or vice versa. And then lastly, we'll go over, Q&A, and that's when we'll unmute our mics and, have a discussion. Okay, so why so many names? I really don't know why they have so many names for the same thing. It does make it super confusing, but with Medicare Advantage, that is also known as Part C. So it replaces Medicare Part A and Part B, and then it may include that drug coverage and may include other benefits, and they roll that all together and they'll call that Part C. It's also known as just like an MA, like with the acronym, so Medicare Advantage, or MAPD, that stands for Medicare Advantage Prescription Drug. On the Medicare supplement side, a lot of people call it Medigap. So it will, so Medigap, it fills in the gaps of original Medicare. You can think of it that way. And the same thing with the supplement. It's supplementing what original Medicare may not cover completely. There's different plan letters that fall under that Medicare supplement umbrella. So some people may call it like Part F or Part G when it's really a plan. So just to clear up the confusion there, so it could be like a Plan F, G, N under that Medicare supplement or Medigap umbrella. Okay, now we're going to break down the differences. So the first one we're going to go over is this cost. Okay, with a Medicare Advantage plan, most of the plans may have a $0 plan premium per month. So that means that, sorry, adding somebody in here. So that means that, it's going to be more of a pay as you go type of plan. So you're paying that $0 monthly plan premium, but then when you have to utilize a plan, now you're paying co-pays or co-insurance for those services until you reach an out-of-pocket maximum. Okay. Now with a Medicare supplement, you may see a higher monthly plan premium per month, and that's going to be the case whether you're utilizing the plan or not. So if you're utilizing the plan, and you will notice that you're going to be paying little to nothing out of pocket when you do so. So it really comes down to what plan letter you enroll in, because each plan letter is going to determine how many gaps of original Medicare that it's filling. So, Plan F, that went away for people turning 65 after January 1st of 2020. But that used to be the most comprehensive plan. They called that the Cadillac plan because it filled in all the gaps. And then the next plan after that may be a plan G, so it looks exactly like a plan F, but it doesn't fill one gap, which is your Part B deductible. That's what you would be responsible for. So that's what that means. The second thing we're going to talk about is network. So with a Medicare Advantage plan, it will look very similar if you're used to having like an employer group plan or an individual plan where they offer HMO type of plans or PPO or even POS. The POS stands for point of service, and usually with the Medicare Advantage plans, if it includes a sort of like a dental plan or even vision plan that say, generally the plan, like the medical part of the plan is an HMO, but they allow you to kind of go in and out of network with the dental. So they'll make that more of a POS plan or HMO-POS plan. So that's kind of what that means. With an HMO, that is going to restrict your network. You're going to have to use your primary care provider. They're going to quarterback for your care. And then when you need to see a specialist, you got to go to your primary care first, and they're going to give you that referral. And then they're going to self-refer within that medical group, most likely. So, whoever your primary care physician is associated with, whatever medical group, that's what you can expect, that medical group to be when you go see that specialist. With a PPO plan, you do have the option to go out of network. However, when you go out of network, your dollar's not going to stretch as far. So instead of maybe like a flat copay for that service, you may see like a percentage. And then with a Medicare Supplement plan, that one will have like, I don't even want to call it a network because it's not a network. So the rule is as long as that provider accepts Medicare, you're good to go and you don't need a referral. So you can go anywhere nationwide without referral as long as that provider accepts Medicare. Okay. Now the hot button topic, right, is that pre-approval prior authorization piece. So with Medicare Advantage plans, you may need to get prior authorization for some of the services that you receive. Okay. With recent developments and, with that big light shining on this topic, a lot of carriers are trying to streamline that, trying to introduce AI to streamline that process. It's kind of interesting when I was looking into this a little bit more. Different carriers may have different percentages for denial rates on services that need prior authorization. So some are lower than others, but it seems like they're all trying to get to the same goal and streamline this and make care available for people on Medicare Advantage plans when they need it and not be hung up by that prior authorization piece. So it's going to be interesting to see how it moves forward and in years to come. With a Medicare supplement, you're not going to see that at all. Okay. And an example I usually give my clients is that when you go and say, you go to the doctor and he's like, you know what, you'd be a great candidate for a knee replacement. Okay. With a Medicare Advantage plan, that gets submitted to the carrier and because it's considered a managed care plan. And then they can come back and say, well, we want you to try these gel injections in your knee first for X amount of months because they're going to be less expensive than that knee replacement. Now with the Medicare supplement, doctor says you'd be a great candidate for your knee, to get your knee replaced. You go and get your knee replaced. No problem. And then lastly, convenience. Okay. So and I think this is really where the Medicare Advantage plans shine, is that they're an all-in-one type of plan. So you just have one card basically for everything. So with the Medicare Advantage plans, like I said before, they may include those extras, those dental, vision, hearing, over-the-counter credits, gym memberships, all of that, and you use one card. And if it has a premium, then you have one bill to pay. whereas Medicare Supplement is very a la carte. So I guess you can see that as maybe like a pro or a con depending on your situation. But, if you wanted like a robust dental and vision benefit, you would get a plan or plans for that. And you're going to have a separate card and maybe a separate bill for each one of those. Or, if you needed hearing, and so on. Or, you want that gym membership. Well, now you may be paying out of pocket, or it may be included in that med sup, depending on that plan design. So just different things to think about. Okay. Now, what if you want to make a change? So if you have a Medicare Advantage plan already, so the time to do so would be during the annual enrollment period, which is coming up right around the corner. I cannot believe it. October 15th through December 7th. Okay, so this is where you can change either a Medicare Advantage plan or a prescription drug plan. So during this time, if you already have a Medicare Advantage plan and you want to move into a Medicare Supplement plan, then you would want to enroll in a standalone prescription drug plan, right? Because you still need that prescription drug plan piece so you don't incur a late enrollment penalty. Other option is there's an open enrollment period from January 1st through March 31st. Okay, and this is only available to people that are already on a Medicare Advantage plan. Okay, so between that time, you're allowed to disenroll from your Medicare Advantage plan, pick up a Medicare supplement, pick up that standalone prescription drug plan. And then depending on when you enroll, so if you do this in February, sometime in February, then the plan would begin March 1st. Okay, so it's going to be the first of the month after, whenever you enroll with whatever month. And then lastly, the special enrollment period. So when you have a qualifying event that happens, so a big one is moving out of the service area. So Medicare Advantage plans, they have those service areas that, that are really come down to even the county that you live in. Now, one thing I do want to note is that if you're making that change from a Medicare Advantage plan, you may have to go through underwriting if you're trying to get into a Medicare supplement plan. So when you turn 65 or enroll in your Part B later, so whichever one is later, starts this 6-month timer for when you have guarantee issue into any Medicare supplement plan. Okay, so people may delay their Part B because they continue to work. So we don't want to penalize those people, right, for working past 65. So that's that kind of scenario. But the takeaway there is that it may not be guaranteed that you can get into any supplement that you want to. Okay, you have to go through that underwriting process, which is answering health questions on an application. Okay. Now, if you are on a Medicare supplement plan already and you want to move into a Medicare Advantage plan, okay, then you can do so during the annual enrollment period again, October 15th through December 7th. Okay. Um, and then you notice that OEP, the open enrollment period, that goes away because again, that's only available for people already enrolled in that Medicare Advantage plan. And then again, special enrollment period. Okay, so if you're moving outside the service area, or if a plan like Joanne had asked right in the beginning, we heard that some Medicare Advantage plans may be going away. So say if there's a service reduction in an area and that plan just terminates and they're not putting you in another plan, then you can move to a Medicare supplement plan. Okay. And in that case, then you do have guarantee issue. So there's kind of that nuance, right? So if a plan is actually terminating and they're not just moving you to another plan, then you do get guarantee issue into a Medicare supplement if you want to. So that would fall under that kind of special enrollment period. With Medicare Advantage plans, there is no underwriting. So everybody is accepted. It doesn't matter. And then the last thing I wanted to mention with that is that there's a trial right period. So up here in the top right, with a trial right period, if you are joining a Medicare Advantage plan for the first time, so whether it's like you just turned 65 and you're enrolling in a Medicare plan for the first time, or if you've been in, say, a Medicare supplement for 5, 7, 20 years, doesn't matter, and you want to try a Medicare Advantage plan for the first time, then you have a whole year to decide if that is right for you. Okay. If you feel like, you know what, this isn't for me, I want to go back to my Medicare supplement plan, then you can do so without that underwriting piece. Okay. So they just give you that 12 months to, feel it out, figure it out. So you're not exactly like just stuck in one decision right off the bat. Okay. Um, okay, and then we're here with Q&A. So I'm going to go ahead and unmic your, not unmic, unmute your mics. So then if you have any additional questions, let me see. Oh, maybe I can't do this. I don't know. I guess maybe if you have a question, throw it in the chat because I don't think I can unmic, or I keep saying unmic, unmute your mic. So sorry about that. I think maybe that was a setting that I had put on in the get-go. Okay, so I see some people typing. So I'm going to go back over Joanne's question that many Advantage plans are going away. So I would say, definitely in different regions, there have been some service reductions. It seems like it's more so in more rural areas. I don't feel that's going to be an issue in our, collar counties of Chicago. I don't foresee that being an issue moving forward. I think there's just too much of a population here to where, it doesn't warrant doing that. Excuse me. I see some people are typing. Okay, so the question is, when will they advise about any changes to supplement plans and or drug plans? So with the drug plans, we'll start there. The prescription drug plan. So with the Part D plans, you should be receiving an annual notice of change, or they call it an ANOC document, ANOC, from the carrier that you're enrolled with. And on that document, it will show, okay, this is what you have for 2025. This is what's changing for 2026. And it's going to outline, okay, is there a premium change from 2025 to 2026? Is there, a copay or co-insurance change? Is there a drug no longer offered on the formulary? And those have to be sent out by October. I think it's by October 1st. If not, it's October 15th, but I'm pretty sure it's October 1st that they need to have those sent out by. So if it's still early in September. So if you haven't received it, maybe give it some more time, maybe, but if you didn't receive it by October 1st, then, I would call your carrier and, request it, and they will, give you a copy of that. Usually you can also find them online on the carrier's website, or, you can always give us a call and we can help you find that. So with the drug plans, also that falls under that same, annual enrollment period, October 15th through December 7th, when you can make those changes, and those changes are going to start January 1st of the following year. Now, with the supplement plans, Those work a little bit different. So technically, you can change your Medicare supplement plan at any time of the year because of that whole underwriting process that's required if you're outside that 6 month guarantee issue time. So if you want to go from one supplement to another, you can do so at any time. You're just a little bit more restricted with that, moving from a Medicare supplement to a Medicare Advantage. And then the premium changes, it depends what carrier you're with. So in Illinois, for example, Blue Cross will submit their rate changes and they will change April 1st. Mutual of Omaha is May, and United Healthcare is June. So it just depends on who you're with, and then but you won't receive like an annual notice of change document as you would with a prescription drug plan or a Medicare Advantage plan. Okay. So it looks like another someone else is typing. Okay, so the question is, have you heard of any increases with Medicare supplement plans monthly premiums? I haven't heard anything. Usually we don't hear anything until maybe 2 months out, if that. Usually, sometimes it's really short timing of when we hear when those changes are happening. But I do know, like with Blue Cross, it's always April 1st. With Mutual of Omaha, it's always May 1st, that sort of thing where they're submitting their annual rate changes to CMS, which is the Centers of Medicare and Medicaid Services. Um, for that review and then they'll send it out to all their beneficiaries, but they are required to let the beneficiaries know at least 30 days prior to any premium changes. So I wish I had that crystal ball that could say, okay, yep, this year we can expect X amount, percentage increase, but we don't. I will say this year I was very surprised at the increases that everybody received, but I don't have any insight for 2026 yet. Okay. Does anyone else have any questions? Or you can try raising your hand. I can maybe try and unmuting a mic. I don't know. Um, but again, if you have any questions, try and throw that in the chat, and we will get answering. Okay. Somebody else is typing a question. Making sure I didn't skip any others. Yeah, so I can't, stress enough on those Medicare or during this time, especially with the prescription drug plans and the Medicare Advantage plans, looking at that annual notice of change, that will give you a ton of information on what's specifically happening to your plan. Okay, another question. If I have a Advantage plan, does it give me coverage in another state or country? Is Advantage limited to coverage only in local jurisdiction? Okay, so I will say it depends on if you have an HMO or a PPO plan. Um, if you have an HMO plan, usually that coverage will only be available for anything that, like if it's an emergency and you need to just go to the nearest emergency room. So it doesn't matter if you're in state or out of state. And then, or urgent care. Okay. Usually those types of service will be covered no matter what. Um, excuse me. On a PPO plan, a lot of or not providers, a lot of the plans that are offered, they really opened up their network. So say if you are like a snowbird and and you go to Arizona for 6 months out of the year, okay, and you have a PPO Medicare Advantage plan. A lot of the carriers now will say, okay, well, as long as you use our network in that state, it'll still be covered as an in-network cost share. Um, because I know some people may have to see like cardiologists every 2 months or whatever it is, but they spend, half the year in another state. So yeah, it really comes down to carrier. And then as far as out of the country, it depends on the plan. So some plans offer out of country, some sort of benefit, other plans do not. My recommendation is because usually are not super robust, or maybe it'll only cover like emergency, worldwide care. So it just, again, it depends on the carrier, depends on that specific benefit. My recommendation is look at maybe a Geo Blue travel policy that's going to cover a lot more than either your Medicare supplement's going to cover or maybe what's available on that Medicare Advantage plan. They're very affordable. So contact us. We can give you a quote or you can go on our website. But, just highly recommend. I use it personally for our family. It's a good product. Okay. Have you heard? Monthly premium. Okay. All right. So if that is all of the questions, I will, wrap this up. And then if you do have any questions, later on, feel free to, to contact us. Um, you can reach us at 630-424-0200. So feel free, give us a call. We'd be happy to answer any, general questions you have. And, thank you to everybody for your time and thank you for showing up and have a wonderful rest of your day. All right. Thank you.